Blood transfusions are a common medical procedure. They are often life-saving. They replace blood lost due to injury or surgery. Transfusions also treat medical conditions that affect blood cells. Blood is carefully tested. It is matched to the recipient's blood type. This ensures compatibility and minimizes risks. Blood transfusions are complex. They require meticulous attention to detail. Before starting a transfusion, careful preparation is crucial. This process involves multiple steps to ensure the safety and well-being of the patient. First, we verify the patient's identity. This is a critical step to make sure that the right patient is receiving the right blood product. This is done using two identifiers, typically the patient's name and date of birth. We check the patient's name and date of birth against their medical records and the blood product documentation. We then double-check the blood product to ensure it matches the patient's requirements. It has to match the patient's blood type exactly to avoid any adverse reactions. This prevents potentially fatal complications, such as hemolytic reactions, which can occur if the blood types are not compatible. The blood component must also be right. Different components like red cells, plasma, or platelets serve different purposes. We need a few pieces of equipment to carry out the transfusion safely and effectively. These include a blood bag, which contains the blood product to be transfused, tubing, which connects the blood bag to the patient's intravenous line, and a needle to insert into the vein. We also have saline solution to help flush the line and a pressure cuff to regulate the flow of blood during the transfusion. With everything ready, we can begin the blood transfusion process. This procedure is crucial for patients who need additional blood due to surgery, injury, or illness. We can start the transfusion. The first step is to ensure that all equipment is sterile and functioning properly. First, we explain the procedure to the patient. This includes discussing the reasons for the transfusion, the benefits, and any potential risks involved. This helps to address any concerns. It's important that the patient feels comfortable and informed before we proceed. We then insert an IV needle into the patient's vein. This allows us to administer the blood directly into their bloodstream. The blood bag is connected to the IV tubing. This connection must be secure to prevent any leaks or contamination. Saline solution primes the tubing. This step ensures that the blood flows smoothly through the IV line. This prevents air bubbles from entering the bloodstream. Air bubbles can cause serious complications if not properly managed. We start the transfusion slowly. This gradual approach helps the body adjust to the new blood. We carefully monitor the patient. Vital signs are checked regularly to ensure the patient is responding well to the transfusion. We watch for any signs of a reaction. Symptoms like fever, chills, or rash need immediate attention. This is most critical in the first 15 minutes. During this time, the patient is closely observed to catch any adverse reactions early. Throughout the transfusion, we closely monitor the patient to ensure their safety and well-being. This involves continuous observation and assessment. We watch for any adverse reactions, which can include symptoms like fever, chills, or difficulty breathing. Immediate action is taken if any of these signs are observed. Regularly checking the patient's vital signs is crucial. This includes monitoring their heart rate, blood pressure, and respiratory rate to detect any changes. Once the transfusion is complete, we carefully disconnect the tubing and remove any medical equipment used during the procedure. Proper disposal of all medical waste is essential to maintain a safe and clean environment. We follow strict protocols for biohazard disposal. Thorough documentation of the procedure is done to ensure accurate medical records. This includes noting any reactions and the patient's response to the transfusion. Aftercare involves continuous monitoring of the patient to ensure there are no delayed reactions. This is a critical part of the process. Ensuring the patient's stability post-transfusion is vital. We make sure they are resting comfortably and are stable. We provide detailed aftercare instructions, emphasizing the importance of rest and hydration to aid in their recovery. Addressing any questions or concerns the patient has is a key part of aftercare. We ensure they feel informed and supported throughout their recovery.